Good evening and welcome to Under the Milky Way. My name is Kim Updegrove and I serve as the Executive Director of the Mother's Milk Bank at Austin. We are a nonprofit milk bank that opened its doors in 1999 in order to save babies by providing prescribed and pasteurized donor human milk. These are the babies who are born too soon, too small, and too sick. There are 60,000 babies born across the United States every single year who are smaller than 3.5 pounds. And for them, human milk only will be acceptable as a source of nutrition, as a source of medicine to help that baby's brain and heart and so many other systems to develop appropriately. That baby has a chance to survive and thrive because of donor human milk. And we are so grateful to the people who have made this happen over the past 22 years. People like milk donors, moms who are pumping more milk than they need for their babies, who donate to the milk banks so that the milk may be pasteurized and provided to babies in need. People who have donated financially in order to support providing donor human milk to all babies in need, despite any financial barrier, despite any lack of insurance, lack of citizenship. So many barriers to the equitable distribution of human milk, and we work on breaking down each one because of the support of our financial supporters and our volunteers. We are here tonight virtually because of COVID to raise funds for the Charitable Assistance Program. We are doing that via this silent auction platform. And so you have 2 days to peruse an exciting array of options on which to bid. Things like a condo in Mexico or an apartment in Paris. So many options. All of the proceeds go to supporting providing donor human milk to those babies in need. So bid often over the next 2 days. And if bidding doesn't bring you joy, go directly to the Paddles Up event and make a donation. I am so grateful to the families who committed to donating ahead of time for this event in the Paddles Up donation area. A $20,000 gift and a $10,000 gift really helps so much to provide milk to these babies. This year alone, we will provide about $400,000 in charitable assistance to the families in need, to the babies for whom anything other than human milk would not be acceptable, giving those families hope, helping those babies to survive and thrive. We can do that with your support. So bid away, enjoy yourselves, invite your friends and family to bid as well, or just donate via Paddles Up. Thank you for being here.
Hi, everyone. Thank you for participating with the Mother's Milk Bank. It's a great organization. There's a lot of things that it does, and it's a lot more than just what you see. What I wanted to do is just give a few words that Ms. Kim Updegrove had asked me to talk about, a little bit about how the Milk Bank came about. And I'll try to do that in 5 minutes as she has asked me to do. So if you bear with me, hopefully I can kind of get that done. But the story begins approximately 2 years before 1999, and I had been caring for a preterm infant that was about 1.5 pounds and born to a teenage mom, a very young mom, and the parents did not want her to provide milk to her baby for a lot of reasons, and it's understandable. But there was no alternative, and therefore the infant was fed formula. The subsequent problems like necrotizing enterocolitis ensued, which is an intestinal infection that actually can damage the bowel. Some of it has to be resected, or the baby may die. In this case, the baby lost more than 2/3 of his intestine, and became an intestinal cripple or a nutritional cripple, which has a really shortened lifespan for them. This was a defining moment for me. I'd been in practice for some time, and I was very disturbed by it. I needed to make a decision because I knew better. I knew with my background in infant nutrition, I'd done a lot of research over the last 12 years or so, and I needed to really get a better handle on what to do next. And I know that there were milk banks in the past. I knew that you could provide donor milk in the past, but those had closed down, many of them. There's very few that were left at the time that this has happened, but they were not really providing any milk to the hospitals at the time. And there was a lot of reasons why they closed, but long story short, we looked into our own information, and lo and behold, those babies that actually were getting this disease, even though we were very pro breastfeeding and providing human milk, there was still quite a few that were receiving formula, and of those, about 20% actually developed the disease and or died. So we needed to do something about it. We felt like a donor human milk bank would be important here in Texas, and so we went to the Texas legislature, and then we went to some of the committees on that, and we approached some of the universities, some prominent universities, asking for their help to kind of provide this, and we were met with the same resistance. They said, no, there's really no proof that human milk actually has any benefit or any more than formula. And this is a problem of prematurity. It's not a problem of not getting donor human milk. So that only strengthened my resolve, and I felt like we needed to kind of do what we needed to do, and that was form a community-based resource. So in between seeing patients and writing notes and all that, I came up with a plan and of what was necessary. We needed to have an organization that did three things because of all the stigmas that were part of this whole area of lack in our medicine. That is, we needed to do outreach, we needed to collect, process, and distribute human milk, but we also needed to do research as well. Without all three, it wouldn't work very well. So that's the way the thought process was at the time. But we needed to talk about the community-based resource, and that was forming a nonprofit, just like our community-based hospitals were based, and that everybody would participate in making sure that it was successful. So we reached out to our colleagues. I spoke with Dr. George Sharp at the time. He was very pro breastfeeding and very pro use of human milk, and he needed to go back to his group and discuss it with them, he said. And he did, and he came back very quickly within about a week or so and said, we found the same results you found, and we're all in. And so we began the formation of this Mother's Milk Bank. We would talk to whoever we could get our foot in the door all over the United States, trying to help educate people on the use of human milk in NICUs, or neonatal intensive care units. And so he did a wonderful job. It was an amazing worker. He never stopped, and he would go one way in the country, I would go another way, and eventually it started to pay off after about a decade. And as more and more people began to realize that this was really the way to go, and so now it is the standard of care. The American Academy of Pediatrics has come out and said, yes, if there's no mother's milk, then the alternative would be to use pasteurized donor human milk. And that, I think, is a big thing to state for them. So we've made some good inroads. I think a lot of the outreach has really helped. It's helped promote tremendous amounts of breastfeeding all over the country, and we're seeing a great resurgence in that, which is great for our babies. And it helped reduce a lot of the complications in our infants, but we still have a long way to go. It's not even near complete where we're at. So I think the story here is, we have started something. It is a conscious idea, and it is a conscious idea of oneness that we kind of forget about because, we've got donors and we got recipients and we got recipient parents and we also have lots of friends of this idea. And the idea, I think, of oneness is that we have connected all these individuals when we currently feel so separated from everything. And I think that's one of the best things about this idea, is that human milk is part of our existence, and it will be there because that is what makes us healthy. And so that's an important part of what we're trying to kind of send the message out to, but also we're all connected. So again, I'd like to thank everybody who has been part of the Mother's Milk Bank in the past, in currently now, and those who have served in the milk bank, those who have currently roles that are basically part of the milk bank right now. And it's an amazing organization, and I don't think that this is an idea that can actually be stopped. It has its own wheels, and it's going to continue to really provide what's necessary for our community, not only here, but all over the world. So again, thank you for participating.
Hello, I'm Dr. Sikandar Adeni. I'm a neonatologist with the Ascension Seton network of hospitals here in Austin. I would like to take a few minutes to talk about the importance of donor human milk in taking care of the smallest babies in our NICUs. Specifically, I want to talk about the important role that donor human milk plays in our practice in reducing the incidence of a serious disease called necrotizing enterocolitis. Necrotizing enterocolitis is a devastating disease for premature infants and can cause death in about 40 to 50% of cases. One of the risk factors for necrotizing enterocolitis is formula feeding. And in 2005, our practice as a whole decided that we would do everything possible to try and reduce the incidence of necrotizing enterocolitis, or NEC as it is called. We made it a policy to feed only breast milk, either from a donor or from mom, to babies with birth weights less than 1,500 grams, and completely avoided formula feeding if possible. Over the next 5 years, we noticed that our rate of NEC dropped by about 20% and continued to drop thereafter every year. And in 2020, we noticed that we were approaching a rate of 0. This would not have been possible without access to a safe, reliable source of donor human milk. And for this, my colleagues and I wish to thank Kim and the Mother's Milk Bank of Austin for being such a great partner in taking care of small, fragile babies. And oh, by the way, the babies thank you too.
Hi, my name is Dr. Jennifer Getz. I'm a neonatologist and a board member at the Mother's Milk Bank at Austin. Thank you for participating in Under the Milky Way and for helping us make sure that donor human milk is available for all babies who need it. We know that breast milk has many benefits, particularly for our smallest, most premature infants. Premature babies that are fed breast milk, either their mother's own milk or donor milk, have improved digestion and tolerance of those feedings. Studies have shown that infants receiving breast milk are able to reach full volume feedings 5 to 10 days sooner compared with infants who are fed commercially available preterm formulas. While that might not sound like much in the context of a 2 to 3 month hospital stay, it really can make a big difference. The sooner a baby is able to achieve full feedings, the sooner we're able to remove central lines, which are needed to provide IV nutrition. While these specialized lines and IV nutrition are necessary for the survival of our smallest infants, they do have the potential for complications. Infections due to central lines or complications due to their malpositioning can set an infant back significantly, leading to short-term problems and even lifelong disability and death. Reducing these complications results in healthier babies who grow into healthy children and even reduces healthcare costs. Using donor milk is one proven way to safely get infants to full enteral feedings faster. With your help, we can make sure the supply of donor human milk is always available for infants who need it. Thank you for your contributions to the Mother's Milk Bank at Austin, and we hope to see you in person again soon.
Hi, I'm Danielle Arnold. I'm a pediatric hospitalist here at Baylor Scott & White Hospital in Round Rock. You and I are here in the room where it happens. This is one of the rooms where women at Baylor Scott & White Hospital in Round Rock labor and deliver and care for their newborn babies. Most of the babies we deliver here are 35 weeks and older, which means that they are near or right at the time that they're supposed to be born. So you might wonder, why do we need to have donor human milk at a place like Baylor Scott & White Hospital in Round Rock? There are plenty of reasons why moms might not be able to provide their own milk. Maybe they're recovering from a really tough surgery after having their baby, and they just don't have the strength to be able to feed just yet. Or maybe their baby has a medical condition that requires them to have more than what milk mom is able to provide. And in that case, for our moms who are devoted to exclusive breastfeeding, we're able to give them access to donor human milk because of our partnership with the Mother's Milk Bank. We love that we're able to give this benefit to our babies. It helps them have access to the neurological benefits that we know come from human milk. And so we're so happy to be able to provide that for our moms. We love the Mother's Milk Bank and we love our partnership with them. We love that nurseries all around the city that are like ours and all around the state and even in the country and all over the world, places who've partnered and learned from the Mother's Milk Bank are able to see the benefits of offering donor breast milk to babies who might not otherwise have access to it. We are so glad that you're investing in the lives of course, our fragile and tiny preemie babies that we're so happy to see grow, but we're also happy that you're investing in one of the most amazing public health interventions we know about, which is making sure that moms have the ability to give their babies human milk. So thanks for all you do, and thanks for supporting the Milk Bank.
Hi, I'm Melissa Fuentes, and I oversee the milk recipient program for the Mother's Milk Bank at Austin. This year, MMBA has dispensed over 700,000 ounces of milk to 171 hospitals, 303 at-home recipients, 3 other milk banks, and 1 dispensation site in Texas and 22 other states in the U.S. We deliver milk to hospitals locally. We dispense it from our lobby at MMBA. And with the pandemic, we have had to move to curbside deliveries so that families can still have access to safely processed donor human milk that can remain safe, and same with staff. So for the milk that goes to outside of the Austin areas and then the 22 other states in the US, we use overnight carriers to handle those deliveries. So the next time you see a UPS truck or a FedEx truck, they might be carrying really precious cargo, which is donor human milk. So let's talk about who receives milk from MMBA. MMBA dispenses milk to many different types of recipients. The majority of our milk goes to babies who are in hospital settings, in the NICU, the PICU, cardiac care units, or even the mother-baby units that are at the hospital. These babies might have conditions like prematurity, neck and short gut syndrome, GI issues, cardiac anomalies, prenatal drug exposure, just to name a few of the conditions that milk is used to treat. Donor human milk is also prescribed in the well baby units for moms who have set a breastfeeding goal and are working really hard to build their supply with their newborns. Families may now also choose to continue using donor human milk at home through the Bridge Milk program, which is something that we recently began offering. It's been a huge success, and it's designed to support new moms briefly to ensure the baby receives adequate nutrition for those first few days of life. Like I said, this program has really taken off this year, and even COVID-19 hasn't been able to slow it down. We've been meeting new parents in the parking lots for over a year now, and we love seeing their little ones as they're leaving the hospital and heading home. But MMBA doesn't stop there. Some of our babies continue to need donor human milk outside of the hospital setting when they have a medical condition or develop a need for milk after other food sources are not tolerated. These babies face conditions like the ones I mentioned earlier, but also could be experiencing failure to thrive, feeding difficulties, formula intolerance, FPIES, neonatal abstinence syndrome, or they might be preparing for or recovering from a recent surgical procedure. So we might serve those babies for up to their first year of life, and then once they graduate from needing donor human milk, we certainly celebrate that moment with their families, but then also hope to continue relationships once they no longer need us. So that's kind of an important thing that we do, is building those long-term relationships with the families that we serve. And in that regard, MMBA is committed to providing donor human milk for as many babies as our supply will allow. Our team recognizes how stressful it is to have a sick baby or to worry if you're making enough milk. We have a lot of parents on staff, so of course we're all familiar with those concerns, and have empathy for our families that are, when they reach out to us, they're really going through a stressful time. So we want to be able to help them and to get them to the next step of life with their child, so that hopefully we've reduced some of that stress that's in their life. We are working on ways to reduce barriers to access to milk, and to ensure that other important stakeholders in this matter, like doctors, insurance companies, employers, even members of the community, can join us and support the needs of children and families in our communities. This is a really important thing that we do for our community, and so we would love to have more people involved in any way that they might be able to help. So I thank you for your time, and I hope you're enjoying the Under the Milky Way event. Take care.
Hi, I'm Caroline, and this is Miles. Miles is about 10 months old. We were introduced to MMBA through our pediatrician when Miles was about a month old. He was having digestion problems, and he wasn't tolerating formula as a newborn, and so she reached out to MMBA on our behalf, and we were luckily qualified for donor human breast milk for Miles, so he's been receiving it now for 9 months, and we are truly grateful for the opportunity to provide Miles with the milk. We truly think that he has benefited in his growth and development. He's a happy, strong little guy. And we just want to thank everybody involved with MMBA and those who support and donate to the milk bank. We are very thankful for you.
Hi, my name is Michelle Easterbaco, and I'm a mom of a milk bank recipient. My daughter Penelope was born 34 weeks and 6 days prematurely. Prior to her birth, I was hospitalized to maximize her growth and development. Upon arrival, she weighed 5 pounds 1 ounce and was quickly taken to the NICU. We stayed there for 2 weeks, and we primarily focused on feeding. She started out using a feeding tube, and then she graduated to oral feeding, which was exciting for us. There we practiced breastfeeding, and I was a pumpaholic all day, every day. However, she had great difficulty with latching, and I presented with a thyroid condition that negatively impacted my milk production. Upon leaving the NICU, we continued lactation support outpatient. There we continued practicing breastfeeding. I was continuing to pump. However, I only pumped enough to support part of her daily milk intake. My husband and I decided to try out the formula. We went down the formula journey to supplement her needs. We tried so many different formulas, but she had a lot of negative reactions like a firm belly, pain, constipation, reflux, vomiting, a lot of colic, and at times she would completely reject any feeding opportunity. It wasn't until, and we sought out a lot of medical assistant specialists, GI specialists. It wasn't until a lactation consultant recommended Mother's Milk Bank of Austin and the use of donor milk to supplement. When we started supplementing with donor milk, we saw incredible improvement very quickly. She would chug it and she wasn't in pain. She didn't have the colickiness, the firm belly, the vomiting, and she enjoyed drinking her milk. We had difficulty with any coverage from insurance. We attempted to try having their assistance, but they would not cover it. And it wasn't until the charitable care program really helped us support her milk needs. We are beyond grateful for that program and for all the donors who contribute to that program, especially the moms who donate, the time and the effort it takes to donate their milk. We're very appreciative. Penelope continued to drink the donor milk until 6 months of age, when her gut and her anatomy developed enough to allow for sensitive formula. She is now 7 months. She is thriving. She's extremely active and has us cracking up all the time, and she's doing really well. My family and I feel very blessed to have this support here in Austin, to have the Mother's Milk Bank, the charitable care program, and moms who are ready and willing to donate their milk. We are beyond blessed. Thank you so much.
Hi, my name is Andrew Reynolds. I am the operations manager at Mother's Milk Bank at Austin, and I oversee the milk processing program. The role of the milk processing program is to take the donated milk that we receive and to make it safe for babies in the NICU. These babies are the tiniest of tiny babies. Most of them don't have a functioning immune system. And one of the best things that we can do for these babies is to provide them with donor human milk as their primary source of nutrition. In order to eliminate any risk from the milk, we pasteurize it. And we pasteurize it for 30 minutes at 62.5 degrees Celsius. That's just shy of 145 degrees Fahrenheit. And for reference, that your water in your home, your hot water in your home, is 120 to 125 degrees Fahrenheit coming out of the spout. If we're successful during pasteurization, we will eliminate any viruses, bacteria that may be present in the milk. Following pasteurization, 1 bottle from every batch of milk undergoes a 48-hour culture. If pasteurization is successful, we will see no growth at the end of that 48 hours, and we can approve that milk and dispense it to our hospitals and recipients. I want to pause and emphasize something real quick. 0 growth, no growth after 48 hours. Our goal isn't just to be good. Our goal is to be perfect in terms of contamination. This makes us very unique among food manufacturing companies. At the risk of alarming anyone, you came into contact with bacteria today. You very likely consumed bacteria today. For you and for me and for healthy full-term infants, a little bacteria is okay. That's how we build up immunity. But for our preterm infants, for our 1 and 2 pound babies, even 1 colony of bacteria could wreak havoc on their little bodies. Our job then in the milk processing program isn't just to eliminate existing bacteria, but it's to prevent the spread, the introduction, the growth of new bacteria. Environmental bacteria, and that is bacteria that lives primarily on surfaces in our processing areas, are abundant. in just about any setting. And we have to have in place very stringent protocols to reduce the likelihood that viruses and bacteria are in our processing labs and therefore in proximity to the milk. Our protocols are really great. They're well constructed, they're well thought out, but our processing team does an extraordinary job of preventing contamination. It takes an incredible amount of focus and diligence to be perfect, to not spread bacteria to the milk, especially given the amount of volume that we are processing. And I would be remiss if I didn't give our milk processing team credit for all the hard work that they have put in to reduce our contamination rate year over year. Of the milk that we've processed this year, 98% of it has been approved, and only 2% are going to fail to meet our standards. I cannot oversell how significant an achievement that is, but it's hard work. It can be physically draining, and on some days it can be emotionally exhausting. The one thing that keeps us going is the mission. We are happy to take on that stress, to take on the strain, because we know we're doing something worthwhile. On some level, everyone that works at the milk bank feels called to serve. And the mission allows us to refocus our efforts when perhaps we're tired or we're stressed. For my part, I was raised to care for others and to particularly care for the least of these. I can't think of people more in need than our preterm infants. I have, as of this October, worked at the milk bank for 7 years. And it's humbling to think about all of the lives we've saved in that time. I was thinking the other day that children born the year I started working at the milk bank will have started second grade this fall. There are second grade kids across the United States that received milk from our milk bank. I packed boxes, I helped process milk that saved lives for second graders around the world. That is so cool. It's so cool to be a part of something that has that type of impact. And I'm all the luckier that I get to do this with a group of people that care so deeply about our mission and about the babies that we serve.
Hi there, my name is Caitlin. I'm on the donor team here at Mother's Milk Bank at Austin. We are in charge of shepherding all of the people who want to donate their breast milk to fragile infants in need. We do that with a 4-step process. The first step is a phone interview, takes about 10 to 15 minutes. Gives us an idea of your health and lifestyle to see if you're eligible to donate. The next step is a written interview. That's pretty similar, but we email it to you and we'll get info to contact your doctors. We'll then send you info to get blood work done to test for any possible communicable diseases. And then our clinical director, Kim, will go through all that info and will ultimately approve you to be a donor. Donor human milk has such a huge impact on our communities. Each ounce creates 3 meals for preemies, which is incredible. All the time I hear donors say, I just want to empty my freezer and make room for, different things. But to us, it's life-saving, and we get to come to work each day and help people do just that, save lives. I mostly work with approved donors. It's an honor to be able to help whoever wants to do this incredible service accomplish that, whether they're shipping their milk or bringing it in locally or in Tennessee or DC. That's what I'm here for. It makes coming to work each day just such a privilege, and I love getting to know each and every person's story. So just know that you're going to be taken care of if you or a friend becomes a donor. We appreciate everyone reaching out. We also work with bereaved donors, which has a very special place for me. It's just such an honor to be able to help people heal and work through their grief by giving to others and saving other lives. I can't stress enough just how important donors are to me and to our team. We couldn't do it without you. So please tell your communities about becoming a donor, how easy the process is, and how much of an impact it does have.
Hi, my name is Michelle Rosas. I'm a supporter of the Milk Bank and a former milk donor. After having my son and being fortunate enough to breastfeed, I learned what a miraculous substance breast milk is. I was also lucky enough to have a small amount of surplus that I could donate to the milk bank. It was truly amazing to me that the milk that I did not plan to use for my son could be used to save the lives of some teeny tiny little babies. I love the work that the milk bank is doing, and I look forward to continuing my support of the milk bank into the future. Thank you.
Hello. Thank you so much for being with us virtually. My name is Christina Garrison Clark, and I am the Breast Milk Equity and Education Program Manager here at the Milk Bank. The mission of this program is to decrease health outcome disparities in Black mothers and infants through breastfeeding education and support. One way we do this is through our doula scholarship component of the program. In this program, we provide people of color in Travis County the opportunity to become certified as doulas. We currently have 4 doulas in training who received our scholarship in April. They've completed the training portion of the program and are on their way to certification. It has been such an awesome experience to work with these women and to witness the passion that they have to make an impact in our community. The second way that we do this is through our community-based breastfeeding support groups. These groups provide safe spaces and opportunities to ask questions, share information, personal experiences, feelings, coping strategies, and overall support about the breastfeeding journey with others in the community. We have launched our first support group and have had the privilege of walking alongside 4 first-time mothers on their breastfeeding journey. We truly appreciate your support and are so excited to see the ways that we continue to impact not only the Austin community, but communities in general. Thank you.
Hey there, my name is Woody Harrison, and I am a filmmaker here in Austin, and I work only with nonprofits. And so that's one of the reasons I came to know the Milk Bank, and also my wife was a big donor during our first child. I've had the privilege of working with the Milk Bank for about 1.5 years, and more recently I've had the honor of telling the story of the garden that's behind the Milk Bank. What they've done with the garden is something really extraordinary. The way that they have given something physical and tangible to a baby who was lost too early is so incredibly thoughtful and meaningful. And what I've been doing with them is telling the stories of some of the names of the babies and the families that are in the garden. And the stories I've heard from these families who have all lost their babies, sometimes at birth, sometimes at 6 months, sometimes at 1 year, and still gone on to donate milk despite this grief, is extraordinary. Their stories are extraordinary. They're humbling. They're uplifting and sad. But it has been a privilege, an absolute privilege for me to be able to hear their stories. And I also just want to tell them again, thank you for sharing such a very personal story with me and with the rest of the community here in Austin and possibly the world. And because of the milk bank. It's because of the milk bank and their heart and their generosity and their mission that this garden is possible, that milk is donated to babies that need it, that babies continue to live because of the milk that they get through the milk bank. And I just want to say thank you for what they do for all the babies in need, but also what they've done for the families that have continued to contribute milk despite this grief, and how they have honored them, because it really is extraordinary. So that's it. I've just been honored and privileged to be a part of this part of the milk bank story and these families' stories. So have fun, everyone, tonight. Raise those paddles. Please donate, because it is such an extraordinarily important organization. Thanks.
Hi everyone, my name is Sarah Jane Cantwell. I am the president and chairman of the board of directors for the Mother's Milk Bank at Austin. Thank you all so much for joining us this year at our Under the Milky Way event. Mother's Milk Bank at Austin has a special place in my heart. I'm a mom of 3, and all of my kids were born a little bit early and all needed to spend some time in the NICU. I understand how scary that is and how uncertain it is, and how you just want the best for your baby, to get them to be as healthy as possible, to come home with you as quickly as possible as well. We have such an amazing process to make sure that the babies that we service and their families have the best there is to give. And because of our donor mothers, we're able to do this. The whole team that collectively makes it to where we can supply what we do at Mother's Milk Bank at Austin is just, it's mind-blowing to me. And it just, every time I think about it, it just makes my heart happy. We have mothers who selflessly give, and to do what they do as far as expressing and donating after making sure their own babies' needs are met. It's huge, and it's a huge labor of love, and it's a gift of love. And then for these babies that have a medical need for what we provide, that's beautiful that it can transfer from other mothers to give to this child. And I know that it means the world to the parents of the babies. I have friends who have children who have been able to receive what we provide for Mother's Milk Bank at Austin, and I know that it meant the world to them. And again, as a mom myself, all you want is the best for your kids. And I'm so thankful that at Mother's Milk Bank at Austin, we're a small part in making sure that these babies have the best start possible. Even if there's a circumstance that's very scary, we do our best to try to circumvent that. Community support is everything for us. Your support, my family's, my friends, all of Austin, everybody that knows about us, your support is what makes it to where we can do what we do. And we not only provide this incredible product to babies, all babies that our hospital service, regardless of their ability to pay, but we also are out in the community, and we are helping vulnerable populations. We are helping to educate, and we're helping to make sure that our mission can continue, and it's all because of your support. Thank you all so much for joining us. I hope that you will all bid and bid and bid on our silent auction items and give during Paddles Up. Please join me in that. I'm really excited to see what we can all do together this year. And I welcome you guys to learn as much as you can and support as best you can, and just join us in this mission. Thank you all.